Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. Back with us today is Dr. Wesley Shankland of the Lima Oral Sleep Center. So welcome back, Wes.
Thank you, George. How are you today?
I'm doing just fine.
Do you feel sleep deprived? We lost an hour last weekend. It's killing me.
No, I'll catch it up.
I know, but I cannot get used to these changes in times.
Yeah.
And it's not because I'm an old guy. When I was young, I couldn't either.
No, I mean, I don't understand why they're doing it now.
I don't, in this society. But last week we talked a little bit about things in sleep, like we should make our bedrooms comfortable and dark and sleep on a regular schedule, not exercise late and drink coffee late. But there are all kinds of things that we can do to help our sleep too. And sleep is a real important thing, as you well know, George. I'm not trying to kid you. If we don't sleep well, we don't function well. And if you don't function well, you don't sleep well that next night, and on and on and on. So there are all kinds of things that we can do to help people at Lima Dental Associates and Lima Oral Sleep Center to help people sleep better. And some of the things we can do is we would bring people in and do an examination, a complete exam. We'd work with a lot of the sleep doctors here in Lima. And I have to say, being from Columbus, the doctors here are outstanding. They're wonderful to work with us. They're wonderful with patients. So we'd examine a patient, do a thorough exam, refer the patient perhaps back to one of the sleep doctors for them to do an exam and do a polysomnogram, a sleep study at nighttime. And that gives us a specific diagnosis as to what the problem might be. And if a patient has mild or moderate obstructive sleep apnea, they'll refer the patient back to us instead of going to a CPAP machine that makes you look like a fighter pilot when you go to bed.
Right.
These oral appliances, I have one right here, that we could use to help people beat that sleep apnea and sleep well, get a good night's sleep and good oxygenation. This is called a Moses appliance. This is one of several different appliances. Over 100 are approved by the FDA. And this appliance has a little like a bleaching tray in the top teeth, and this other one goes in the bottom. And what it does, it brings your lower jaw slightly forward. So, George, when you lie down, your jaw can't fall back, and your tongue and musculature and your muscles can't cut off your air and collapse your airway. This is very, very comfortable. You can still talk and sip water through this if you want when you sleep.
Yeah.
It works very well and very helpful to people instead of using a CPAP. So we have all kinds of appliances we can use.
Oh, so that's a terrific idea.
Yeah, it's very comfortable, easy to make.
How do they contact you for this?
It's they can contact us by calling 419-224-7667 or 224-SNORE, S-N-O-R.
Any final words?
Yes, keep smiling, keep sharing, and I know you keep caring.